Electronic Health Records, EHRs. What is an EHR? An electronic health record, EHR, is a digital version of a patient's paper chart. It contains comprehensive health information, including medical history, diagnoses, medications, treatment plans, immunization records, test results, allergies, and more. EHRs are designed to be shared across various healthcare providers and organizations, allowing for seamless communication and improved care coordination. Overview and key differences between EHRs and EMRs. EHR versus EMR. While both electronic health records, EHR, and electronic medical records, EMR, are digital forms of patient data, the key difference lies in their scope and usage. EMRs are digital versions of the paper charts used by clinicians for diagnosis and treatment. They are typically confined to a single healthcare provider or organization and are not easily shared with other providers. EHRs, on the other hand, are designed to be accessed and shared across multiple healthcare settings, allowing different clinicians and specialists to collaborate and provide comprehensive care. Key differences. EHRs contain a broader scope of health data and are intended for sharing between healthcare providers, enhancing the overall coordination of care. Electronic medical records are often used within a single healthcare setting and focus on individual patient care within that specific organization. The evolution of EHRs in healthcare. The journey of electronic health records, EHRs, in healthcare has been shaped by technological advancements, government policies, and the ongoing need for more efficient and coordinated patient care. Here is a detailed look at the key phases in the evolution of EHRs. 1. Early developments, 1960s to 1980s. Initial concepts. The roots of EHRs trace back to the 1960s when the first digital health records were created, but they were very limited in scope. During this time, computers were mainly used for administrative tasks, and health records remained largely paper-based. First digital systems. In the 1970s, medical institutions started experimenting with digital systems to store patient information, but these systems were often isolated and used only within individual healthcare settings. The role of pioneers. Researchers and early adopters began developing prototypes for EHRs, with some notable systems emerging in universities and large hospitals. These early systems, like the Regenstrief medical record system in the 1970s, demonstrated the potential of digital records in improving patient care and reducing errors. 2. Growth of health informatics, 1990s. Emergence of EMRs. By the 1990s, the concept of electronic medical records, EMRs, became more prominent. These systems were primarily used to digitize paper charts within a single practice or hospital. Limited interoperability. The use of EMRs expanded during this period, but these systems were often isolated from one another and lacked the ability to share information across different healthcare providers or organizations. Health information technology advancements. The development of health informatics as a field began to grow, promoting the idea that healthcare could benefit from digital technologies, including EHRs. 3. Government support and incentives, 2000s. High-Tech Act and meaningful use. The U.S. government played a pivotal role in accelerating the adoption of EHRs. In 2009, the Health Information Technology for Economic and Clinical Health, High-Tech Act, was enacted, providing financial incentives for healthcare organizations to implement EHRs. Meaningful use. The High-Tech Act also introduced the Meaningful Use Program, which set specific criteria for EHR functionality and interoperability, aiming to ensure that EHRs improved patient care and supported better data exchange between healthcare providers. EHR adoption. Surge. By the late 2000s, the push for widespread EHR adoption gained momentum, leading to more hospitals and private practices adopting digital record systems to to meet government incentives. Fourth, integration and interoperability, 2010s. Progress in interoperability. Interoperability, the ability for different EHR systems to communicate and share information, became a central focus. Healthcare providers, tech companies, and policymakers worked together to develop standards for data exchange. Meaningful use. Stages. The government continued to refine the Meaningful Use program, with subsequent stages addressing more complex aspects of EHR functionality, such as the use of clinical decision support, patient engagement tools, and data exchange between different healthcare providers. Shift to cloud and mobile solutions. The rise of cloud computing and mobile technology further accelerated EHR adoption, making EHR systems more scalable, accessible, and user-friendly. Mobile applications also allowed healthcare providers to access patient records on the go. 5. AI, Big Data, and Precision Medicine, 2020s present. AI integration. The 2020s saw the integration of artificial intelligence, AI, and machine learning into EHR systems. These technologies help with clinical decision support, predictive analytics, and automation, allowing healthcare providers to offer more personalized and efficient care. Big data and analytics. EHRs now play a central role in aggregating large volumes of patient data. Advanced data analytics tools allow healthcare organizations to identify trends, improve outcomes, and provide evidence-based treatments. Focus on patient-centered care. Modern EHRs emphasize patient engagement, allowing patients to access their own health records through patient portals, track their health status, and communicate with their healthcare providers. This shift reflects a growing emphasis on patient-centered care. Global adoption and interoperability. Countries worldwide have moved toward EHR adoption, driven by both technological advancements and regulatory pressure. There is also a growing focus on global interoperability to ensure that healthcare data can be shared across borders, facilitating international care coordination. 6. Future trends and challenges. Blockchain for security. As security remains a major concern in healthcare, some experts predict the use of blockchain technology in EHR systems to improve data, privacy, and security. Blockchain can provide decentralized and tamper-proof records, enhancing trust in digital health data. Personalized medicine and genomics. EHRs are evolving to support personalized medicine by integrating genomic data, lifestyle factors, and advanced diagnostics to tailor treatments to individual patients. AI-driven predictive healthcare. The future of EHRs will likely involve more predictive capabilities, using AI to anticipate health issues before they become critical, providing earlier intervention opportunities. Benefits of EHRs: improving patient care, data accessibility, and cost efficiency. Improving patient care. EHRs provide healthcare providers with up-to-date, accurate, and comprehensive patient information. This leads to more informed decisions, better diagnosis, and timely interventions. EHRs can also help reduce medication errors by providing alerts about potential drug interactions or allergies. Data accessibility. One of the primary benefits of EHRs is the ability to access patient data instantly, regardless of location or time. This allows healthcare professionals to make better decisions, even in emergencies. It also ensures that specialists and other providers have access to the same information, improving coordination and continuity of care. Cost efficiency. EHRs contribute to cost savings by reducing the need for paper records, minimizing transcription errors, and reducing hospital readmissions through better care management. The ability to track patient outcomes also helps organizations identify cost-effective treatments and procedures.